A patient using albuterol via metered-dose inhaler reports increasing use from twice weekly to 4 times daily. What is the most appropriate nursing interpretation? A. The medication is working effectively. B. The patient is developing tolerance and needs higher doses. C. Asthma control is inadequate and therapy needs reassessment. D. The inhaler device is malfunctioning. Answer C. Increased reliance on short-acting beta-2 agonists such as albuterol indicates poor asthma control and possible worsening airway inflammation. Rescue inhalers are intended for intermittent symptom relief. Frequent daily use suggests the need for reassessment of long-term controller therapy, such as inhaled corticosteroids. It is not simply tolerance, but a marker of uncontrolled disease. A patient receiving inhaled fluticasone is at greatest risk for which adverse effect if proper technique is not followed? A. Hypertension. B. Oral candidiasis. C. Bradycardia. D. Hypoglycemia. Answer B. Inhaled corticosteroids can suppress local immunity in the oropharynx, leading to fungal overgrowth such as oral candidiasis. Rinsing the mouth after inhalation significantly reduces this risk. Systemic effects like hypertension or glucose changes are less common at typical inhaled doses. The nurse administers ipratropium to a patient with COPD. Which mechanism explains its therapeutic effect? A. Stimulation of beta-2 receptors. B. Inhibition of leukotriene synthesis. C. Blockade of muscarinic receptors in airways. D. Direct mucolytic action. Answer C. Ipratropium is an anticholinergic bronchodilator that blocks muscarinic receptors in bronchial smooth muscle, preventing acetylcholine-mediated bronchoconstriction. It does not stimulate beta receptors or affect leukotrienes. Its effect is bronchodilation through parasympathetic inhibition. A patient taking Theophylline presents with nausea, insomnia, and palpitations. The nurse suspects A. Subtherapeutic drug level. B. A Theophylline toxicity. C. Allergic reaction. D. Bronchospasm. Answer B. Theophylline has a narrow therapeutic index. Early toxicity signs include gastrointestinal upset, restlessness, insomnia, and tachycardia. Severe toxicity can cause seizures and arrhythmias. Monitoring serum levels is critical to prevent complications. Methylxanthines is most effective for which condition? A. Acute bronchospasm. B. Prevention of exercise-induced asthma. C. Immediate relief of COPD exacerbation. D. Treatment of pneumonia. Answer B. Methylxanthines is a leukotriene receptor antagonist used for long-term control and prevention of asthma, particularly exercise-induced bronchospasm. It is not effective for acute attacks because it does not produce rapid bronchodilation. A patient using a dry powder inhaler states they shake it vigorously before use. The nurse should respond. A. That improves medication delivery. B. Shaking is unnecessary for this device. C. You must always shake all inhalers. D. You should rinse it with water before shaking. Answer B. Dry powder inhalers do not require shaking because the medication is delivered as a powder, unlike metered-dose inhalers that contain propellants. Shaking may actually interfere with dose accuracy. Proper patient education improves drug efficacy. Which assessment finding indicates effective response to a bronchodilator? A. Decreased wheezing. B. Elevated blood pressure. C. Increased sputum thickness. D. Reduced respiratory rate below 8 per minute. Answer A. Bronchodilators relax airway smooth muscle, improving airflow and reducing wheezing. A dangerously low respiratory rate is not therapeutic. Thickened sputum suggests poor hydration or mucus clearance. A patient receiving systemic corticosteroids for asthma exacerbation should be monitored closely for A. Hyperkalemia. B. Immunosuppression. C. Severe bradycardia. D. Hypotension. Answer B. Systemic corticosteroids suppress immune response, increasing infection risk. They may also cause hyperglycemia and fluid retention. Hyperkalemia and bradycardia are not common primary effects. The nurse instructs a patient to wait how long between two different inhaled medications? A. No waiting required. B. At least 1 minute. C. At least 5 minutes. D. At least 30 minutes. Answer C. Waiting about 5 minutes between inhaled medications allows the first drug, often a bronchodilator, to open airways, improving absorption of the second medication, such as a corticosteroid. A child prescribed a spacer device with an inhaler benefits because it A. Delivers medication faster. B. Reduces systemic absorption. C. Improves drug deposition in lungs. D. Eliminates need for inhalation. Answer C. Spacers reduce oropharyngeal deposition and enhance delivery of medication into lower airways. They improve coordination and reduce local side effects. A patient develops tachycardia after frequent albuterol use. This occurs due to A. Beta-1 receptor stimulation. B. Alpha receptor blockade. C. Histamine release. D. Muscarinic activation. Answer A. Although selective for beta-2 receptors, high doses of albuterol can stimulate beta-1 receptors in the heart, causing tachycardia and palpitations. Which drug class is contraindicated in patients with narrow-angle glaucoma? A. Anticholinergic bronchodilators. B. Leukotriene modifiers. C. Inhaled corticosteroids. D. Mucolytics. Answer A. Anticholinergic drugs like ipratropium may increase intraocular pressure if aerosol contacts the eyes, worsening narrow-angle glaucoma. Acetylcysteine primarily acts by A. Suppressing cough reflex. B. Reducing airway inflammation. C. Breaking disulfide bonds in mucus. D. Stimulating surfactant production. Answer C. Acetylcysteine is a mucolytic that disrupts disulfide bonds in mucus, decreasing viscosity and facilitating expectoration. A patient abruptly stops long-term prednisone therapy. The greatest risk is A. Adrenal insufficiency. B. Hypertension crisis. C. Bronchospasm. D. Hypernatremia. Answer A. Long-term corticosteroid use suppresses adrenal gland function. Sudden discontinuation may lead to adrenal crisis due to insufficient endogenous cortisol production. Which finding suggests overuse of nasal decongestant spray? A. Improved airflow. B. Rebound nasal congestion. C. Reduced blood pressure. D. Dry cough. Answer B. Prolonged use of topical decongestants causes rebound congestion, rhinitis medicamentosa, due to vasodilation after drug effect wears off. A patient on Xylitol requires monitoring of A. Renal function. B. Liver enzymes. C. Thyroid levels. D. Hemoglobin. Answer B. Xylitol may cause hepatotoxicity, requiring periodic liver function tests to detect early damage. Which medication is classified as a long-acting beta-2 agonist? A. Salmeterol. B. Albuterol. C. Ipratropium. D. Prednisone. Answer A. Salmeterol provides prolonged bronchodilation and is used for maintenance therapy, not acute relief. The priority teaching for inhaled corticosteroids includes A. Take only during attacks. B. Discontinue when symptoms improve. C. Use daily as prescribed. D. Double dose if wheezing. Answer C. Inhaled corticosteroids control chronic inflammation and must be used consistently, even when asymptomatic. A patient receiving oxygen and bronchodilators has improved ABG results. Which indicates better ventilation? A. Increased PaCO2. B. Decreased PaCO2 toward normal. C. Decreased oxygen saturation. D. Increased bicarbonate. Answer B. Effective ventilation removes carbon dioxide. A decrease in elevated PaCO2 indicates improved alveolar ventilation. Which adverse effect is common with antitussives containing codeine? A. Diarrhea. B. Insomnia. C. Respiratory depression. D. Hypertension. Answer C. Codeine suppresses cough by acting on the CNS but may depress respiratory drive, especially in high doses. Combination inhalers often include corticosteroid plus LABA2. A. Cure asthma. B. Provide rapid emergency relief. C. Control inflammation and maintain bronchodilation. D. Replace oxygen therapy. Answer C. Combination therapy addresses both airway inflammation and bronchoconstriction for long-term asthma control. Which patient should avoid first-generation antihistamines? A. Young healthy adult. B. A patient operating heavy machinery. C. Seasonal allergy patient. D. Mild rhinitis case. Answer B. First-generation antihistamines cause sedation and impair alertness, increasing accident risk. A paradoxical bronchospasm after inhaler use requires A. Continued dosing. B. Immediate discontinuation and evaluation. C. Doubling dose. D. Ignoring symptom. Answer B. Paradoxical bronchospasm is rare but serious. The drug should be stopped and provider notified immediately. The nurse explains that inhaled medications act faster because they A. Bypass hepatic metabolism initially. B. Increase kidney clearance. C. Bind plasma proteins. D. Are absorbed in stomach. Answer A. Inhaled drugs reach lungs directly and avoid first-pass liver metabolism, producing rapid onset. A COPD patient benefits from tiotropium primarily due to A. Short duration. B. Once daily long-acting bronchodilation. C. Strong sedation. D. Rapid rescue effect. Answer B. Tiotropium is a long-acting anticholinergic that provides sustained bronchodilation for maintenance therapy. Which symptom suggests corticosteroid-induced hyperglycemia? A. Excessive thirst. B. Bradycardia. C. Hypotension. D. Sweating. Answer A. Corticosteroids increase glucose production and decrease insulin sensitivity, causing hyperglycemia and polydipsia. The best indicator of effective asthma long-term control therapy is A. No nighttime awakenings. B. Frequent rescue inhaler use. C. Daily wheezing. D. Elevated peak variability. Answer A. Absence of nighttime symptoms indicates good asthma control and adequate anti-inflammatory management. A patient reports tremors after beta-2 agonist use. This occurs due to A. CNS depression. B. Skeletal muscle stimulation. C. Histamine blockade. D. Serotonin inhibition. Answer B. Beta-2 receptor stimulation in skeletal muscle can cause fine tremors, a common side effect. Before administering inhaled medication, the nurse should first A. Position patient upright. B. Lay patient flat. C. Restrict fluids. D. Administer sedative. Answer A. Upright positioning promotes optimal lung expansion and effective inhalation of medication. Which outcome demonstrates successful mucolytic therapy? A. Increased cough suppression. B. Thinner, easier to expectorate sputum. C. Decreased hydration. D. Lower heart rate. Answer B. Mucolytics reduce mucus viscosity, facilitating productive coughing and airway clearance, improving respiratory function.